Hello everyone and welcome back to the channel. In this video, we'll break down the four main parts of Medicare, A, B, C, and D, so you can understand what each one covers, the pros and cons, and how to choose the right plan for your needs. Whether you're just starting to explore your options or you're already enrolled but want a refresher, we've got you covered. Let's go ahead with the video. First, let's take a look at Medicare Part A. Medicare Part A is your hospital insurance. It's designed to cover the costs associated with inpatient hospital stays and certain related services when you're admitted for medically necessary care. So what does it cover? So what does Medicare Part A cover? This includes a semi-private room, meals, general nursing care, and drugs administered during your hospital stay. Part A covers short-term stays in a skilled nursing facility, SNF, for rehabilitation or skilled nursing care after a qualifying hospital stay. If you're facing a terminal illness with a life expectancy of 6 months or less, Part A covers hospice care to provide comfort, pain management, and support services. Part A covers certain home health services, like skilled nursing care, physical therapy, and occupational therapy, if you meet specific eligibility requirements. Now that we know what is covered, let's take a look at the pros of Medicare Part A. Part A covers crucial services for major medical events like hospitalizations and skilled nursing care. This provides peace of mind, knowing you have financial protection for significant healthcare needs. If you or your spouse paid Medicare taxes while working for at least 10 years, 40 quarters, you're typically eligible for premium-free Part A. This can result in significant savings over time. You don't have to worry about actively enrolling in Part A if you're already receiving Social Security or Railroad Retirement Board benefits. You'll automatically be enrolled when you become eligible. Part A helps you avoid massive out-of-pocket expenses for hospital stays and related services, ensuring you're not burdened with overwhelming medical bills. While not comprehensive, Part A covers a wide range of essential inpatient services, providing a solid foundation for your healthcare coverage. Now let's take a look at a few drawbacks of Medicare Part A. If you have an extended hospital stay, Part A coverage has limits. After a certain number of days, you'll be responsible for coinsurance or all of the costs. Part A doesn't cover custodial care, which is non-medical assistance with daily activities like bathing, dressing, or eating. This can be a significant gap in coverage for those needing long-term care. Even with Part A, you'll still have out-of-pocket costs in the form of deductibles and coinsurance for each benefit period. These costs can add up if you have multiple hospital stays. Part A typically covers semi-private rooms. If you want a private room or private duty nursing, you'll have to pay those costs yourself. To qualify for SNF coverage, you must have a qualifying hospital stay of at least 3 days and need daily skilled care. The coverage is also limited to a certain number of days. Now, Medicare Part B is your medical insurance. It covers a broad range of outpatient medical services, doctor visits, preventive services, and some medical equipment. So what does Medicare Part B cover? Part B covers visits to physicians, specialists, and other healthcare providers for medically necessary services. This includes consultations, exams, and treatments. This includes services you receive without being admitted to a hospital, such as lab tests, x-rays, outpatient surgeries, and mental health services. Part B covers a variety of preventive services aimed at early detection and prevention of illness, including screenings, mammograms, colonoscopies, vaccinations, and annual wellness visits. If your doctor prescribes it, Part B covers certain medical equipment like wheelchairs, walkers, oxygen equipment, and hospital beds. Part B covers medically necessary ambulance transportation if other forms of transportation could endanger your health. Now that we know what is covered, let's take a look at the pros of Medicare Part B. Part B covers a wide range of essential outpatient services, giving you access to necessary medical care, diagnostics, and treatments. By covering preventive services like screenings and vaccinations, Part B emphasizes early detection and disease prevention, promoting better health outcomes. If you need specialized care, Part B ensures you can see specialists for diagnoses and treatment of various conditions. Recognizing the importance of mental well-being, Part B covers outpatient mental health care, including therapy and counseling. While some Medicare Advantage plans have network restrictions, Original Medicare, Part A and B, allows you to see any doctor or provider who accepts Medicare. Now let's take a look at the drawbacks of Medicare Part B. Part B isn't free. You'll pay a monthly premium based on your income. The standard premium in 2024 is $164.90 per month for most people, but it can be higher if your income is above a certain threshold. Part B has an annual deductible, $296 in 2024, that you must meet before coverage kicks in. After that, you typically pay 20% coinsurance for most covered services. Part B covers a very limited number of outpatient prescription drugs, usually those administered in a doctor's office at some chemotherapy drugs, certain injections, routine dental care, most vision exams, and hearing aids aren't covered by Part B. You'll need to purchase separate coverage or choose a Medicare Advantage plan that includes these benefits. If you want supplemental insurance to cover the gaps in Original Medicare, like deductibles and coinsurance, you'll need to purchase a Medigap plan, which adds to your overall healthcare costs. Now, Medicare Part C, also known as Medicare Advantage, is an alternative way to get your Medicare Part A, hospital insurance, and Part B, medical insurance benefits. These plans are offered by private insurance companies that contract with Medicare. So what does Medicare Part C cover? Medicare Advantage plans must cover all the services that Original Medicare Part A and B covers, except hospice care, which remains covered under Part A. Most Medicare Advantage plans include prescription drug coverage, eliminating the need for a separate Part D plan. Many plans offer extra benefits not covered by Original Medicare, such as vision, dental, hearing, fitness programs, and even transportation to medical appointments. Now that we know what is covered, let's take a look at the pros of Medicare Part C. Medicare Advantage plans often provide more comprehensive coverage than Original Medicare by bundling in Part D and extra benefits like vision, dental, and hearing, making them a one-stop shop for healthcare needs. Some Medicare Advantage plans may have lower out-of-pocket costs than Original Medicare. Many plans have an annual out-of-pocket maximum, limiting your financial risk for covered services. Medicare Advantage plans often emphasize care coordination, meaning your healthcare providers work together to manage your care, which can lead to better health outcomes. Some plans offer additional benefits like transportation to medical appointments, 24/7 nurse hotlines, and online resources, making it easier to access and manage your healthcare. There are numerous Medicare Advantage plans available, with different coverage options, benefits, and costs. This allows you to choose a plan that aligns with your individual needs and preferences. Now let's take a look at the drawbacks of Medicare Part C. Most Medicare Advantage plans require you to use doctors, hospitals, and other providers within their network. Going out of network can result in higher costs or no coverage at all. Some plans require you to get a referral from your primary care physician before seeing specialists, which can be an extra step in accessing care. Medicare Advantage plans can change their benefits, costs, and provider networks each year, requiring you to review your plan annually to ensure it still meets your needs. Coverage for care outside of your plan's service area can be limited, which can be an issue if you travel frequently or have a second home. While some Medicare Advantage plans have $0 premiums, others may have monthly premiums in addition to the Part B premium you still need to pay. Now, Medicare Part D is an optional add-on to Original Medicare, Parts A and B, or can be included in a Medicare Advantage Part C plan. Its purpose is to help you pay for prescription drugs. So what does Medicare Part D cover? Part D plans cover a wide range of prescription drugs, including both brand name and generic medications. Now, however, each plan has its own formulary, list of covered drugs. Part D plans are required to cover all or substantially all drugs in certain protected classes, such as those for cancer, HIV, AIDS, and mental health conditions. Some vaccines, like the shingles vaccine, may be covered under Part D. Now that we know what is covered, Let's take a look at the pros of Medicare Part D. If you take prescription drugs regularly, Part D is essential for managing your medication costs. It can significantly reduce your out-of-pocket expenses for medications. There are numerous Part D plans available, each with different formularies, costs, and pharmacy networks. This allows you to choose a plan that best fits your medication needs and budget. Part D provides crucial financial protection from high drug costs, especially for individuals who take expensive medications for chronic conditions. Even if you enter the donut hole, a temporary coverage gap, you'll still receive discounts on brand name drugs, and the coverage gap is gradually closing under recent legislation. Knowing that your medications are covered can provide peace of mind and help you better manage your health. Now let's take a look at the drawbacks of Medicare Part D. Part D plans require a monthly premium, which varies depending on the plan you choose and your income level. Plan formularies can change annually, meaning a drug you currently take might not be covered in the future. You'll need to review your plan each year to ensure your medications are still covered. Part D plans have annual deductibles and copayments or coinsurance for each prescription, which can add up if you take multiple medications. Although it's closing, the coverage gap, donut hole, can still result in higher out-of-pocket costs for a period until you reach a certain spending threshold. Choosing the right Part D plan can be complex due to the variety of options and the need to consider your specific medication needs. It's helpful to seek guidance from a licensed insurance agent to find the best plan for you. Medicare offers diverse coverage options to cater to various needs and budgets. Part A safeguards you with hospital insurance. Part B addresses outpatient and preventive care. Part C bundles these benefits with potential extras, and Part D tackles prescription drug costs. The ideal plan for you depends on your individual health needs, financial considerations, and preferences for flexibility and additional benefits. Take the time to compare plans thoroughly, utilize resources like the Medicare Plan Finder tool, and seek personalized guidance from trusted advisors or state health insurance assistance programs, SHIPs. By understanding the nuances of each plan, you can confidently choose the coverage that best suits your unique situation and empowers you to prioritize your health and well-being in your golden years. And there you go. I hope you have found this video helpful. See you guys next time.